Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you are ready for liftoff. We are live now. Welcome to Planetary Health First, Mars Next. It is an awesome day today, and we have a special guest, Eden. I love that name in healthcare. It's like joy. It's the best name for healthcare, and she is the director of behavioral science at Impulse Mobile. And that's going to be a lot of our conversation today about behavior science and healthcare. She's going to really unpack that. And she's really excited about what she does. She's part of the team that designs modern engagement programs that make healthy behaviors cases easier to learn, and that's due and to sustain. Eden is a self-proclaimed nerd that loves learning and doing research. She has a background in psychology and did her master's in public health with a focus in behavioral science at Boston University. She lives in Boston with her two French bulldogs. And so, Eden, please share a little more about yourself. If there's anything else I failed to mention, please, for our audience.
Yeah, of course. I'm so excited to be here today. If I cough a few times, it's just that lovely things going on in the world. Everyone's sick or coming out of sickness. But like Michael said, my name is Eden Brownell. I am Director of Behavioral Science at Impulse Mobile, which is really all about behavior change within healthcare and trying to close gaps in care when it comes to health plan members. I had a tricky start into behavioral science. I originally was a theater major in college who quickly realized that I loved understanding the psychology of the main characters and their motivations. And really, I was more well suited to psychology because I am just a huge people watcher. And I ended up in public health because I wanted to really help people at scale. I always joke that empathy is my superpower, but also my kryptonite. So I needed to be at like a more macro level to be able to help people. And yeah, love all things behavioral science and excited to chat about it today.
Cool. Well, this is awesome. I feel really fortunate that we're here. I have to say, Reva, your colleague at Impulse Mobile, was like, you got to talk to this person. We had a great talk in the 2013, but Mike, you need to talk to our behavioral specialist, Eden. And she connected me, and here you are. So this is great. So if you're out there, please, when you're hearing people talking with me, we always love friendly, hey, you should definitely talk. So Eden, you're here. I think also before we get going, I think it was really powerful that you shared your own your own health journey, your own mental health journey. If you would just, briefly, if you could just share a little bit about that. I think that's so important today. Even just as important as post-COVID or during COVID when we started having more conversations. But I'd love if you were able to share some about that.
Yeah, so I think during our first conversation, you had just acknowledged my LinkedIn post about my own sort of discovery and mental health journey of multiple years of sort of misdiagnosis or mismanaged medications, and ultimately coming to the determination with my psychiatrist that I have bipolar 2, which anyone who's familiar with it knows that it can be quite a tricky diagnosis and quite a tricky thing to live with and manage and find the right combination of medications. So I think ultimately it only lended to a even more robust empathy for the members that I, design solutions for every day. How do you try to understand mental health and behavioral health and the complexities of health insurance and finding medications and the cost of things? And it's just really brought a whole newfound understanding of that to my perspective in my day-to-day work.
Nice. So with you going back to behavioral science and healthcare, where should we start with this topic?
Yeah, I mean, maybe what is behavioral science versus behavioral health? I think there's a lot of misunderstanding between the two. And so behavioral health is going to be more similar to, behavioral health initiatives, mental health awareness, things like that. It's, how do we, just like we were just discussing with my diagnosis, how do you make sure that folks are being diagnosed, that they are being treated, that there are resources available. There's a lot of changes coming to HEDIS, Medicare, Medicaid in terms of behavioral health payment plans and things like that. So that's sort of behavioral health, mental health. And behavioral science is actually the study of human behavior and is sort of a combination of a bunch of different disciplines, borrowing from psychology and sociology, behavioral economics, neuroscience, all of these things kind of playing together to understand why do people do what they do and why do they do things that maybe they shouldn't do. So it's especially relevant when it comes to healthcare as you think about, okay, why don't we all go get our flu shot as I'm sitting here a little sick? Why don't we all get, the cancer screenings at the times that are recommended? And so behavioral science is really about unpacking some of that, unpacking the behavioral barriers that exist to members actually taking those actions, and how do you understand them in order to overcome them?
So I'm thinking of like Facebook and social media, how it's like got so much data on us, and um, like how is it that I imagine you're using similar data, information gathering, but doing it in a good way, not in a surveillance way, right? So how do you separate? I like. I guess there's a lot of nudging, but you have to know your members. So maybe you could forgive me if I'm going down a rabbit hole, redirect me. But if I'm not, maybe you could just start with a little more unpacking that science.
Yeah, of course. So interesting that you say, you bring up like the Facebooks and the social medias. I always like to joke that I like to think of myself as sort of a good guy when it comes to applying behavioral science. Behavioral science is everywhere around you that you look. It's just most of the time, if done well, not as recognized. I think people are getting more, understanding that there's sort of these persuasion tactics all around them. But I mean, there's behavioral science teams at Netflix, at Amazon. Netflix is obviously, what behavior are they trying to change? They're trying to have you stay on Netflix as long as they can. Amazon, they're trying to have you shop more. I always, when I'm trying to show people behavioral science, I say one quick way to sort of look at, a difference of a personalized difference is if you looked at my Amazon home screen versus maybe your own. The things that would pop up, obviously, based on, our different search recommendations, but the way that they promote those items, even if we were to be looking for the same one, they might use different appeals or behavior change techniques or cognitive biases. And so instead of just all the jargon, what does that mean? So for example, social proof might be one. Look, like all these other people like you are buying X product, whereas authority bias appeal might be, this is expert recommended. And so based on all of the lessons learned about us, Amazon is basically using those appeals differently based on the person that they're up against. So I might have a lot of social proof appeals because they've seen that really nudges me, whereas you may get authority bias or, there's too many actually cognitive biases. I think where the most recent codex that they've shared is over 160, and I think they're coming up with new cognitive biases every day, which really isn't the full understanding of what behavioral science is, but it is sort of a way to quickly understand some of the applications of it. And so that's really Amazon. And so for healthcare, how do we sort of be the good guys? So we're not trying to motivate you to buy more or watch more or anything like that. We are trying to get you more engaged in your healthcare. And how do we, sort of outweigh the barriers that might be things like cost or, transportation or time or just the a lot of it is just not understanding the importance of it. So weighing it against other things that are right now in the moment, sort of a present bias. I have to fix my car. I don't want to think about managing my condition that I can't really think of the impacts because it's not going to impact me until the future. How do we bring some of those things more into focus now? And so that's a lot of what we will use data for. And a lot of our data is a lot different in healthcare. We're sort of making sure we're compliant, following HIPAA. And so the way we get at it is a lot more self-reported and listening to member responses. So at mPulse Mobile, what I really liked about it when I got started is the platform and the natural language processing that we have that sits on it. And so while we're running these campaigns, and we've run like over, millions of text messages and, phone calls and emails over our SMS platform, we're listening to members. So we are trying to understand the different pathways that they could take outside of what we even predicted. So like I said, behavioral science is trying to understand and know the barriers that members may face when it comes to a target behavior. So we will do our literature reviews, we'll do all the research before, we'll come up and assign sort of barriers and make sure that we have, messages associated with each so that if members fall down that. But the other beauty is what we learn from members themselves. So say maybe originally we didn't have transportation as a barrier for medication refills. But we saw very quickly that when we asked members why they weren't refilling, they were saying, I don't have a car, I don't have a way to get there, I don't have time to go to the pharmacy. And so things like that, we really start to analyze those topics that bubble up and then build it into our system so that next time it's not a sort of like, sorry, we don't understand you response or a generic, call member services. It might be something more targeted based on the health plan's resources. So someone says they don't have a car, we're going to say, oh, well, do you know that most prescriptions can be delivered to your house or that you can get 90-day fills? So we use data sort of in that way and more of an analysis of things that we're getting in real time in order to impact the behaviors that we're trying to drive.
So Eden, I'm hearing like two things. One is that your system is real and it's dynamic and it's getting better with the data aggregation of the members, and you're starting to see trends, and then you can actually input those messages to do better. And then the other thing that I'm curious about that I think is fascinating is it sounds like there's an art between the data and the science of it, and then the art of behavior science and sort of the softer, not that that's less technical, but I imagine you work with data scientists and different collaborative team members in order to make this thing happen. It's to me, I'm fascinated by it.
Yeah, it's definitely a super collaborative area. I sit within product, which is great because how do we actually inform the product and build in behavioral science from the get-go? So things like this that there's one of the really well-known books in behavioral science is Predictably Irrational by Dan Ariely. And so in a lot of ways, how do we predict the human behaviors that we know are going to happen? So that's, again, coming from our literature reviews, coming from research that may have been done. So we're building in those into the solution design. So for any given target behavior, we are already making sure our system has sort of those predictable patterns baked in, because most systems follow a happy path and then break down when they don't, when members don't follow the happy path, which, not everyone's going to get a message and say, yes, I am going to get my colonoscopy right now. You can't just build for that. It's not reality. And it comes into that like predictably irrational piece. Maybe everyone really wants to get their colonoscopies, but there's XYZ things going on. And so what we try to do is really from the get-go, have an understanding of that, have an understanding of also the behavioral science that's works specific to that target behavior. So what are, when it comes to colonoscopies and even a colon cancer test kit at home, it seems like something like, why aren't people signing up for that? They're free. You can do it at the convenience of your home. We're going to mail it to you. But still that, we ran a test at Impulse around this, and, it was sort of the standard messaging. Do you want your kit? Yes or no? And we saw pretty low opt-in rates. So this is where we started to think, okay, behavioral science, what's been done out there in the world. We pulled from research done by Katie Milkman at UPenn, and found that with vaccine hesitancy, so an unrelated topic, but how do you get people to get flu shots or COVID shots? There was a really robust study that they did testing like over 20 something behavioral science appeals to see which ones impacted the behavior most. They ended up finding that if you said something similar to a vaccine's been reserved for you, like, or you have a reserved vaccine test. So this idea of endowment effect, this is yours. If you don't use it, you're sort of missing out, which triggers another psychological concept that's pretty prevalent in
FOMO.
Yes, FOMO, or the, I guess, more jargony loss aversion term. And so we do not like losing things that are ours. If it's not yours, it's sort of like, okay, it's there. But as soon as it becomes yours, there's like, I don't want to lose that. Like, that is mine. Don't take it from me. Very built into, human behavior. And so the simple act of changing, do you want to receive a colon test kit, to do you want to receive your colon test kit, and making it, rather than yes, no, a sort of more, active choice of, yes, I want to receive my test kit, or no, I don't want to receive my test kit. We saw over a 10% lift in members who then said yes after receiving that message that was really powered by a subtle shift in language, just understanding human behavior, that members are more likely to, when they feel something's theirs, they don't want to miss out on it. Like you said, FOMO.
Wow. I love that. That's scary. A 10% over millions of messages is a lot.
Mm-hmm. Yeah. And when it comes to something as important as colon cancer kits, and getting tested for that, it's a big deal. And for it's, there's different levels of the equation. So for me, I'm interested in the science, but I'm so interested in the actual human impact that means, of people getting diagnosed earlier, finding things that may have turned into late stage diagnosis. And then, but for clients, it has a really real impact, and, makes a difference to the ROI of it all. If you have more people not getting late stage and having all of those type of treatments and are able to diagnose it earlier and find it, you're improving your HEDIS rates, and you're ultimately, seeing cost savings from those type of initiatives.
So AI, I think you've heard of that, generative AI. You've heard it too much, maybe a lot. And where is behavioral science intersection with generative AI? Are you guys doing anything with that right now?
So I think behavioral science and generative AI in most industries is happening. I think healthcare is going to be a little slower to adopt because of the privacy concerns, the human interaction pieces. So although we have a system that's using machine learning, all of our responses have been thoughtfully sort of co-developed with a health plan, versus something that, generative AI could spit out. If someone says, I can't afford it, they might tell them to like go get a job, or who knows what's going to happen. It's going to say they're going to send like a job, site, or say I don't have a car, they're going to send them car ads. We don't know what's going to happen. Yeah. So we really we're using things to the best of our ability. But I think when it comes to human interaction, I'm pretty nervous about sort of the empathy of AI to deliver that type of communication.
Mm-hmm. Yeah. So it seems like you have already embedded in your software and your programs a lot of stuff that's already been AI, already been the automation, and the generative AI is just really not there yet, and maybe not necessary for what you're doing.
Yeah, we're looking at it. One of the other great tools that we have at Impulse is our engagement console. And so, how do you actually, okay, we have automated text messages that we're really trying to make as, real life as possible, but, nothing's as real as actually communicating with someone. And so our engagement console is really where we can send certain, maybe we find while we're trying to reach out for colonoscopy screenings that we have a whole group that says, I need help scheduling. I tried, I couldn't, like all these things that bubble up to this. They need someone real time to help them. Those we could then put into sort of like a bundle that would go into engagement console, which is where actual real members of the health plan staff can interact with them. So this is an engaged person. This is someone that wants to be active in their healthcare. So it's sort of saving a lot of that outbound dialing that, health plans may currently be doing. And so part of where we think generative AI could be interesting is just in the messages and workflows that could help come up. So it would be so someone could come in and I need help scheduling and I can't afford it or stuff. And so we could have built-in sort of generative AI cost responses, but that would always need that human can kind of copy and paste it, but like edit it. So is there sort of just a speed to do something that could be improved versus allowing it to handle the interaction all on its own?
Yeah, sort of like a safeguarding, kind of like a supervision of it before sending. Yeah. So just sort of a solution or a way to help increase that worker's creativity or kind of the tools, but in the end, they're still pressing that button, if you would.
Right. Because it could be, maybe it's just pulling on the knowledge of all the interactions it's had, but it could be, they have multiple case managers and said case manager doesn't know about XY incidents that another case manager dealt with, but the system does. And so it could be sort of, this is how a similar scenario was handled when a similar response came in. And so being able, apologize for my...
No, we love dogs. I have 2 dogs, and if we don't get a dog scratching on the door, we're not doing a real planetary health first. So,
like, put me on camera.
yeah, no, or Amazon comes to deliver a package, right? But anyway, we are here on Planetary Health First, and we love your 2 French bulldogs.
Yes.
Yeah, so those bulldogs are good. So tell me what resources I think would be awesome too, is we don't want you to give away your special sauce. Obviously there's algorithms, there's the proprietary stuff that you work on with Impulse Mobile, but what I think would be great is there's probably people out there, a community of behavioral scientists or behavioral scientists, students or but there's people out there within healthcare that would love some of these resources that are maybe leaders, operation leaders at companies. And so after this, it would be great if there's some resources you might want to share, or even some books that you love. And if you want to share anything that's coming up to bubble up now, let me know.
Yeah. I from previous webinars, I've sort of created you pick your adventure kind of resources, knowing that some people like books, some like podcasts, some like newsletters. So there's definitely sort of a adventure for everyone. One of my favorite 2 books that are right near me, so I'll bring them up because they're 2 of my favorite ladies also in behavioral science. But one is Amy Boucher, and this book has been written in and doodled, and it's engaged and designing for behavior change. She talks quite a bit about different products and their application. There are quite a few healthcare examples in here. And then another that just does a really great job, because one of the things of behavioral science is people can sometimes make it so jargony that you're like, well, okay, but what does that look like in the day-to-day? And so that's kind of why I tried to bring down, endowment effect and loss aversion with the colonoscopy example. And so Nancy Harhut, who does using behavioral science and marketing. So this one is just each chapter, it's kind of taking a different sort of behavior change technique and actual examples of how to apply it and sort of the increase she's seen from various case studies that she's done. So those are really great ones, just based on my bookshelf here of some of the books that I, have read and go back to frequently.
Is there a conference that you attend regularly, like annually, of like the behavioral scientist nerds?
Us nerds. So there is Nudge, which is actually out of I think it's Ogilvy that started it, Rory Sutherland. So very much like advertising, which is sort of the way I sort of learned my beginning of behavioral science was advertising. How do you get people to do a thing? It's exactly what advertising is all about. So there's that, and I'm blanking on the other one, so I can add that to my resources after. But a lot of them are virtual conferences that I attend. And there's a few other that are research related as well that I can send over.
And I want our audience to know I referred you to as nerd because you in the bio, if you just jumped on, this is how you refer to yourself. Okay, I'm not, and nerd is a cool thing. Nerd is empowerment. I guess 20 or 30 or 50 years ago was something else. So nerds are super cool.
Oh, totally. I say it all the time. I'm a nerd. I get brought in usually to nerd out on topics. I'm super passionate about what I do. And so I am always wanting to learn more about, how can I do it better? And so there's definitely a lot of resources out there. And even for anyone that's listening to this, I try to regularly take calls and video chats with students and folks that are trying to understand, like, well, that sounds really cool. How do I get involved? I had someone attend a conference that I was doing a workshop at, and they later reached out and was like, my daughter's really interested in this. She saw some of the materials. Can she meet with you? And so I really love that, because I know myself, I was a little lost when I was just a psychology major, and where am I going to go? And I've landed in a place that I really love. And so if others are, passionate in the same way, I'm always happy to try to help navigate the tricky world of, careers.
No, that's great. Now, Eden, is there, with your discipline and your subject, is there some that is more on the technical side, like really digging deep into the data stuff, doing that, or is it a broad discipline? Tell me a little bit about the discipline itself, kind of the tools and techniques.
Yeah, so I'd say there's definitely sort of you can do it all of the behavioral science, but I feel like a lot of the time there's also behavioral data scientists. So at our company, we actually, Julia Donald, I'll give her a little, she's a little genius is the best way to put it, data nerd. And she would not deny that. She really helps us analyze, okay, if we're going to come up with the sort of control group and the test group, how do we make sure that those are, all the things randomized? How do we then analyze the outcomes for true sort of impact? What did the intervention actually do once you sort of pull out the rest? And so I feel like within behavioral scientists, there's definitely, you can go more of a quantitative way or qualitative. I feel like I kind of sit in the middle. I am not great at manipulating Excel tables and things like that. I am just really good at knowing what to ask of the data. And so how do I make it sort of tell a story, or how do I shape it in a way to, be able to find out answers?
I think I just gave you a new title. You are a data behavioral maestro conductor. So you are not the violinist, but you're the conductor and maestro of all things behavioral science.
Love it. I'm going to just change my LinkedIn headline right now. People are going to be like, what is that? Watch the show. You'll get it.
Yeah. I
Yeah.
don't know. That's what I was thinking. Just I don't know if you saw Bernstein, Leonard Bernstein with Maestro. That was just anyway, that was a Netflix thing. So anyway, I was just thinking of, you know, but what so tell me about you. You have your two dogs, you drink tea, you drink coffee. What do you do when you're not doing behave? I know you're probably doing a lot of that offline too, because you're thinking, living and breathing this, but um, you know, tell our audience just a little bit about yourself.
Yeah. So I'm drinking tea. I had to give up coffee. Just giving me all kinds of belly issues. So we're on to chai lattes. And I do love to read, but I'm not always reading my nerd books. But I do love to read more psychology thrillers, who did it kind of things. I'm always trying to, I guess, probably uncover the ending before um, the ending. I think like most people do. Yes, I definitely read a lot of books, and I'm actually a big gamer, which surprises a lot of people. So I'll say that I had two brothers and grew up with a lot of video games, and I just recently got the new Meta Quest, so I am exploring all things VR, and I have to say VR in healthcare is the next thing I'm waiting for. I think that they've tapped
Mhm.
into VR and fitness, and so part of it is like they have really fun. I got one of the fitness type of ones where you're boxing, and but I'm really interested in how VR can be used for recovery, or are
Mhm.
there different ways that VR can be used in healthcare that haven't really been tapped into yet? So there I go, bringing my personal
Yeah.
into how does this translate to my work.
Yeah, no, I love it. I'm glad I asked that. I almost thought, well, gee, so you need to stop, you need to focus, Michael, because that's one of my problems. I'm kind of the creative type, but I'm glad I asked that because VR is fascinating. I know there's some drawback right now. I was talking to someone recently, the last week or so. I forget the conversation exactly, but it sounds like the nausea has not been, there is a side effect of that. If I'm hearing that has made the adoption a little challenging because you have to go through a period to kind of be okay with that feeling. I don't know. That's what I was told. That's one of the issues with preventing the adoption.
Yeah, and I wonder if they've looked at like, is it a bigger sort of adoption curve for folks who regularly play games or not? I wonder if there's
Mhm.
a bigger sort of, because even like a video game that's really intense and moving and things like that, like if I bring that out in front of friends that are never played a video game, they're like, what is happening? Just total overload of things. But I did notice myself when playing, it's just because it's this whole thing, and it's also like the safety of it. Like it does this whole thing to outline your area of play, but it's still, I'm always like, where's the real world?
Yeah.
so so it's definitely adjustment.
I imagine the adoption rate is much more uh, faster uptick or whatever your words are with behavioral science with the gamers. It seems like that is the pocket where there is really stickiness, and that's probably, you're absolutely right. I don't want to go too far down. I'm trying to redirect, this behavioral science topic. Um, I think this has been great. I'm so glad you're on. Um, I am. I really, and I'm going to say it again, Reva. Thank you, your colleague Reva, that with Impulse Mobile, that recommended having you on. She's so right. I feel like this could just be a series of 4 parts or 3 parts on behavioral science, and we're just getting started. The other thing that I am curious about is like, what conference do you have, a conference on your radar? I know you shared behavioral science, but just in general, a healthcare conference that you are going to be attending that you find value in 2024?
Yeah, so I think our team is sort of reviewing right now what will where we'll go and what we'll attend. I've attended a few in the past that I found helpful, but I think still trying to find which one is like really for the behavioral science side of it. And it's also trying to bring it to conferences that maybe haven't had it yet. So I think there, healthcare, behavioral science in healthcare, even texting in healthcare is relatively still new and something that folks are adopting. But when I have been at conferences and even at we do a conference, Impulse does, Activate. And at that, we ran a couple behavioral science workshops this past year. And it really resonated with folks. I think it makes sense. It's all wrapped around human behavior, even when you're acknowledging and understanding. We did sort of a barriers analysis type of workshop. And I think as you're uncovering them, you see even within those barriers, like your own barriers and objections that you've had to those health activities. And so there's just that sort of common sense to it. But in terms of this year, I think I'm a little behind on figuring out where I want to go, healthcare ones. But I did have it as my New Year's resolution to be better at sort of applying to speak at conferences and things like that. I've just started doing it recently, and I really enjoy talking about all things science.
Yeah, I think that would be great. I think you'd make a great speaker for everyone in healthcare. I mean, it's a specific topic, but it's general enough to attract a wide audience because that's all we're trying to do. The final sphere in healthcare is behavior science, sustainable change. Like, how can you get people to continue to do what they're supposed to be doing? I don't care what it is, but that's what you are in. And so people would really, just like I've sought after you, Eden, to have just a nugget of your wisdom here on the show. So, we have not done a good job in healthcare with, talking about obesity, diabetes, talking about all the things that we know, exercise. Those are the things that are needed and I'm sure you can make a huge impact with people with your science. So.
Yeah, I think that, there's within behavioral science and folks, I might actually lift, my dog is crying right now and is going to end up being in this. So I'll show him quick on our screen so everyone can see the little man behind the madness.
So that is behavioral science at its work. The power of the smile and the empathetic dogs have on our owners. They're pretty powerful how they can get us to do things, right?
He just can't get his little legs. He can't get up on the bed on his own. So he's like, I'll just start crying. And I don't know. Yeah, it's got to be a behavioral aspect to that.
Well, we're kind of coming towards the end, Eden. This has been great. Anything else that you think would be all things behavioral science that you think would be important to let our audience know?
I'd say there is so much out there to definitely learn about behavioral science. We have been sort of, studying different behavior change techniques and things and how you can apply them within healthcare. Obviously, the endowment effect was an example. We've tried to do social proof as it relates to women getting mammographies. We've done loss aversion when it comes to diabetes and eye exams. And obviously that's another one where it's folks are not thinking about maybe the long-term repercussions of not getting screened now, not having well-managed diabetes and things. So we explored sort of how do we bring that future state to you, especially as it comes to, populations with diabetes. How do you, with eye health? It's one of those, it's encouraged to have a yearly eye exam for diabetic retinopathy. And folks will put it off, but it's, really meant to uncover things before they become a total issue, before you're starting to have, cataracts or complete loss of vision. And so part of what we did in one of our videos was actually sort of showing, you're watching this video as if it's, through your perspective, and you're watching like a baby like playing and learning to like take its first steps, and all of a sudden there's sort of black spots coming up on the screen or blurred vision, and then it sort of ends with like, just a total blackout of like, you can't see things anymore. And so how do you really overcome present bias to show what a future reality look like if you don't do the behavior now? And so we're always looking for taking these concepts and playing them out and experimenting with them. And I think that's what keeps me fascinated about behavioral science, and especially within healthcare, because there seems to be so much use for it, and that hasn't been explored yet. So I think it's a fun place to dig in, and I'll share resources after with you so you can get them out to the audience. But it's definitely a fun place to be.
Yeah, no, this has been great. I'm so glad we were able to coordinate a time. It's not always easy with work and all the other commitments. And thank you for your flexibility, but your persistence and saying yes. And so I think if there's last takeoffs with behavioral science, anything that you can think of, any last thoughts?
I'd say behavioral sciences, as we just went through the new year, I think behavioral science is really interesting, even as you think of your own self-development and things that you can do to impact your day-to-day. It's Katie Milkman wrote a book about like ways to change, and it's, as you hear about New Year's, you keep hearing about like there's this concept of the fresh start effect, which is really pulling from behavioral science. That it's a great time to start new things, or it could be your birthday, or it's the start of the new month, or a start of a new week. People will find these milestones, and that really all comes back to behavioral science and important times and commitments. And so I think even behavioral science can be applied to all the industries, but it can also be really impactful in everyone's day-to-day life. So just go out and learn.
I love that. I think that's a great spot to finish. This has been so awesome having you on. Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.